A well-managed healthcare system is able to balance itself, and with the right amount of health contribution, it is really manageable. But the key here is good management. Over the past year, instead of good management of healthcare systems, we see problems piling up. The opposition says enough is enough and demands the resignation of Minister Izabela Leszczyna. The way Minister Leszczyna is acting is very peculiar. It is an attempt to divide the responsibility among different entities, among whole circles. It is an attempt to start quarrels. What we need is a Minister of Health who has a real plan. The financing of the health system leaves much to be desired. The Razem party has criticised next year's draft budget and announced that it will submit an amendment to increase the subsidy to the National Health Fund by an additional 20 billion zloty. The budget lacks at least 20 billion zloty, not to fix the health system, but just to keep it functioning. A budget like the one presented by the government means that thousands of people will need treatment and will be turned away. Problems don't stop there. Starting in January, the Department of Health and Human Services plans to drastically cut access to home rehabilitation. This will affect people with severe disabilities. As of the 1st of January, 400 of the 2,780 facilities that currently provide home rehabilitation under outpatient rehabilitation contracts will be eliminated. The accessibility of home rehabilitation will be drastically reduced. Up to 20,000 physical therapists could lose their jobs, and approximately 1 million people could lose access to services. We do not agree with the circumvention of the law from 2018 by the order of the President of the National Health Fund, that is, the actual restriction of the possibility of home rehabilitation by institutions that have a contract for outpatient rehabilitation. Are these changes just another cost-cutting measure to fill the hole in the budget of the National Health Fund? These are foolish savings. In the long run, the financial costs will be much higher. The social costs will be even higher, and the most important thing in all of this is that if we take away this remaining work from physiotherapists, they will leave, take the opportunity, and get employed elsewhere in Europe. Talks with the Ministry of Health and the National Health Fund yielded no results. On the 6th of November, physiotherapists and caregivers of the disabled are organising a protest in front of Parliament. Speculation is rife as to whether Civic Platform MP Ivana Hartwig, who was the face of the protest in Parliament a few years ago, will show up. I was asked by a patient why, in a situation where people with disabilities are being deprived of support, MP Ivana Hartwig is not organising a protest. What will the MP say, and what will she ask Minister Leszczyna in this situation when people with disabilities are deprived of opportunities for ordinary, necessary rehabilitation? There is discontent in the medical community. Nurses are even going on strike. Doctors are outraged by Minister Leszczyna's words about allegedly gigantic salaries. The most worrying thing is that the ministry is playing different groups of medical professions off against each other. On the one side, she gives examples of some exorbitant salaries of doctors, and on the other, she puts the other medical professions who might feel wronged in this situation. Problems in the healthcare system are causing Poles to seek help elsewhere. A study by the Central Statistical Office shows that more and more people are seeking private treatment. One of the reasons is that getting appointments at the National Health Service takes too long. However, private treatment is expensive and not everyone is able to afford it.